Saludos amigos y bienvenidos a Altus Nurse, su podcast de enfermería, práctica avanzada y especialización. Gracias por su apoyo. Recuerden darle share, compartir el material y hacer sus comentarios y sobre todo suscribirse para seguir recibiendo el material. El día de hoy yo voy a estar haciendo una entrevista en inglés porque ella no reside en Puerto Rico, ella vive en Miami, así que voy a comenzar introduciendo. I'm honored to have with us Darlena Banas. She's a dual certified nurse practitioner. She has a family nurse practitioner board, and she also has one in nephrology, this certified nephrology nurse practitioner. She's been working as an NP for 34 years now.
I've been working as a nurse practitioner for 12 years, and I've been in nephrology for over 34 years.
Oh my God.
Yeah.
So we are honored to have you here. Thank you for sharing this time with us, Darlena.
Thank you for having me. It's an honor.
Sure. My first question for you is, can you briefly share with us how you entered the field of nephrology and what initially drew you to this specialty?
The funny thing is, I really originally was I wanted to be in ER, emergency. And with unfortunate circumstances in my progress to changing into starting my nursing, I became ill and I ended up having to take a different route where I ended up going LPN at the last minute because my schooling that I was going to start, I couldn't do it because of circumstances. And in the midst of me going through that program and the LPN program at the hospital that I was attending and working, then also going to school there, they actually introduced me to nephrology during my clinicals, and I fell in love with it. From the moment I walked in, I was like, what is this? And at that time, they didn't have LPNs working in nephrology. It was either you either had to be an RN or you couldn't work in nephrology. And I think at that time, they were slowly introducing patient care technicians into nephrology where they had PCTs working. And I ended up falling in love. The doctor that was there ended up training me and another LPN and offered us a job after we graduated. I, of course, accepted because it was a great opportunity. We were the first LPNs to be invited or even working in the hospital with nephrology. And from that day on, I never looked back. I never did any other specialty. I never worked in any other job capacity other than nephrology. I fell in love with it. I started off doing acutes in hospital. At that time, the hospital had a in-hospital dialysis unit, so it was unusual. Everything was all, a monitor. Everybody, the nurses that are around me were RNs, and it was just me and another guy that was LPN. And from there, I just continued to improve in go up in the ladder. I went from LPN to RN to charge nurse to clinical manager. And from clinical manager, I went to nurse practitioner. So, I was a clinical manager for almost 16 years for one of the dialysis facilities before I even went into nephrology and into my nursing practitioner program. So, it was something I fell in love with from day one. It was, I saw it as, it was the only specialty that I saw that you could actually see what you do for the patients and you see the results right then and there. If the patient was feeling bad, there were certain things that in nephrology that we could do that all of a sudden you could see them feeling better. You could see the results that you did. You could see how the decision that you made impacted the patient. So it was something I just fell in love with, and I love the intensity of it. Let's be real. Nephrology is not an easy specialty. It's very exciting. There's a lot that goes on. Our patients are very complicated. So it's intriguing. And so it was perfect.
And you've been there from very few perspectives since
Right.
LPN, then RN, then the manager, and now as an NP. So you have
Mhm.
a whole perspective of it in terms of
Yes.
in Puerto Rico, the nurse practitioner
Mhm.
role in nephrology still underdeveloped. From your perspective, what factors allowed the role to flourish in the island?
I think the what allows the nurse practitioner in nephrology to flourish is the advocacy, the having the ability to, you know, have that support from the other nurse practitioners that are around you, that that are in that role. They know their roles. They know how strong they can be. They have the support of each other. I think the problem these days is that even today, even back in the days, there's a lack of understanding the magnitude of how nurse practitioners impact a practice or a specialty. Nurse practitioners are, more than just a nurse. We write prescriptions, we see patients in the office, we round, we give orders, we sign orders. We have that same capacity as the physicians. We just work in a different way. Our approach is from a nursing approach, unlike a medical approach. So we look at the patient as a whole. So not only when we're treating a patient, we're not just looking at the medications, but we're also looking at the patient from their finances. We're looking at the dynamics that are going on at home. We're looking at how it's affecting them mentally, how it's affecting them, the people around them. So there's a beauty in being a nurse practitioner and having a nurse practitioner in your practice, because you have someone that's going to look at your patient in a totally different perspective. We're going to give you the patient's going to be treated based on all kinds of other factors that are involved with the patient. So you're giving a different level of care. And I think that's important when it comes to caring for your patients, is to have that type of eyes and ears out there monitoring your patients, taking care of your patients. They get to know your patients on a different level. So you're providing the best care out there. And I think that's important. Not many people understand that nurse practitioners have a very important role when it comes to the care of their patient.
Yeah, and from the perspective of an NP that have been in nephrology for so many years before, you know what happened after providers put an order, what came next, and all the dots that has to be connected in order to receive the prescribed treatment or whatever it is. And you already know that as an NP, and you know whatever you need to do in terms of coordination for the services.
Correct. So especially with the nurse practitioners, it's the same. If the doctor gives an order, if the medication needs a pre-authorization, we do the pre-authorizations. If the patient needs a signature or some paperwork filled out for workman's comp or things like that, we fill those out. For transportation, same thing, we sign for those things. So, you know, there's very little limitations with what your nurse practitioners are able or not able to do. I mean, I think it also comes down to how the practices use their nurse practitioners. I like in my practice, our doctors use us to our full capacity, and then I might have a sister nephrology group that their nurse practitioners don't work in the same capacity. Like, for instance, we take call. So we
Mm-hmm.
take call. I'll have call in a week time, and I have call 1 week in a month. Okay. So we are always have call once a week. So we do call, but I know that there are some nurse practitioners that their practices don't have them do any call at all. We round in the hospitals. Some practices don't have nurse practitioners that they round in the hospitals. They may only focus on them rounding in the dialysis units. I think it's just comes down to how the practice uses their nurse practitioners? Are they using them to the full capacity that they have? And my practice does. I mean, we do various things. And I mean, I see patients in the office. I have my own patients. I see the dialysis patients. I do pre-authorization. So there's all kinds of things that we can do. It just depends on how well you're using your nurse practitioner. Are you using her to the full capacity that she's, that's allowed under her license?
Yes, and those lines in Miami, the MP role is independent or it is collaborative?
So actually in Miami, in Florida right now, nurse practitioners can work on their own. They have that ability to have their own practices. I actually have several nurse practitioners that are family nurse practitioners that actually have their own practices here without, uh, and their own practice. But the only thing is, depending on what you're doing in that practice, depends on if you have to have a medical director under you, or you're under a medical director for signatures or things like that. But a nurse practitioner, yes, in Florida has the ability to have their own practice, and they're doing very well here. Actually, nurse practitioners are right now leading in family practice when it comes to primary care. There are more nurse practitioner providers out there now that are in practice than there ever was before, and it's growing, especially in family practice.
Yeah, and in terms of nephrology,
Mm-hmm.
yes, is require a collaborative agreement.
Yeah, so in nephrology, you need a collaborative agreement. I know, like I said, Florida here, you can work on your own. You have that ability to have your own practice. But nephrology, yes, I do have an agreement with a collaborative physician with me.
That's a specialty, of course.
Yeah, as a
Um,
specialty.
and how does what are the primary responsibilities of a nephrology NP in the clinical setting you work?
So in my group, in nephrology itself, nurse practitioners, we round on the dialysis patients. And when I mean we round in the dialysis units, we see the patients once a week. We are responsible for reviewing labs as well as medical records with the patients. We also examine the patients. We make decisions regarding their dialysis treatments. We put in orders. We sign our orders. We also review any changes that may have occurred with the patients, even in the hospitals, of course, with our patients. Our group also have nurse practitioners that round in the actual hospital, so we do hospital consultations as well. For me, I work mainly outpatient, so I see dialysis patients in center as well as we do home, but I don't do the home at this point in time. Right now, I'm doing mainly the dialysis units. I do see them once a week, and I see all of them probably. I see the patients all once a week, and the doctors see the patients once a month.
Okay.
And during that
3-1.
time,
It's a 3-1 model. One the
yes,
doctor, and
right.
three.
It's a 3-1 model. The nurse practitioners see the patients at least 3 times a month, and the doctor sees them once. In my practice, I see my patients every week, whether the doctor sees them or not. Most of the time, I still see them. So my patients usually get seen 5 times. They get seen 4 times by me and 1 time by the doctor, because it's just my patient's preference. They still want to see me, so I do see them.
And Darlene, how do you arrange your week in terms of the shift of the patients you see, the roundings in the hospital, the clinic? How is a typical week for you?
So I round on my patients based on the time that they're coming off. So depending on the time of when their treatment starts and when it's ending depends on how I set up my schedule. So I usually go to my clinics the same days. There's certain days that I go to certain clinics that are in that area, so I can see them on the time where they're on the actual machine.
Okay.
I try to catch all of my shifts while they're physically on the machine so I can examine them, talk to them about their treatment. So I time it where I catch those shifts. So I might do the first shift for all 3 or 4 units in that area. And then the second shift may come and I might go back to those units. So some units will see me 3 times a day. Some units may see me twice a day. Some units may see me just for that first shift. Maybe, I'll go back to them another day because I have the Monday, Wednesday, Friday patients that I see either Monday, Wednesday, or Friday. And then because I have office on Thursdays, I see all of my Tuesday, Thursday, Saturday patients mainly on Tuesday. So that's probably my heaviest day is Tuesday. I see between 11 and 12 shifts of patients on Tuesday. So I start very early in the morning and I end pretty late in the day on Thursdays. And then Wednesdays, I have a unit that's a little bit further than the rest of my units. So I have 2 other clinics that's a little close, well, 3 other clinics that's a little closer to that one. And I arrange my visits for those clinics and that clinic all together. So I always look at the area that I'm covering and then I make that decision to see whatever patients, are there during that time. Now, if I have a patient, because here in our group, we do startup patients in center. So if I have to start up a patient in center for whatever reason, I may, change my schedule up so I can be in that area to start up a patient at another clinic. And I might just go ahead and round on that shift or round on a different shift that's closer to that area, just so I can see that patient or a new patient. I try to veer my schedule around what is needed for the patients.
Okay, so you see the ESKD patients on the dialysis clinic, but you see also CKD patients in a private clinic, right?
Right. So my office is located in one of the dialysis facilities I round in, and I mainly have office on Thursdays. So my office starts about 8:30 in the morning and may finish between 1 and 2:30 in the evening. So I see between probably 15 to 20 patients during that time. So I'll round in the dialysis facilities before I go into office, and then I round in the dialysis facilities when I finish office.
Okay.
Yeah.
And you collaborate with the interdisciplinary team, particularly with social worker, dietitians, the nephrologists as well?
hmm So everything that's the beauty of nephrology is everything is a team. You have your nurses, you have your PCTs, you have your social worker, your dietitians, the secretaries, the charge nurses. Everybody works together to provide that care for the patient. So even though I'm seeing around in the patients, I do seek out the PCT who's monitoring that patient all day and say, hey, is there anything that's going on with the patient in particular that I should know about? I don't just check with the nurse, I check with the PCT, I check with the patient. The social workers reach out to me if they need, some assistance with forms or any suggestions on certain things regarding the patients. I may have a dietitian reach out to me to, address something going on with a diet with a patient, or, you know, if something's going on where they need to contact me on getting a prescription for a binder or switching a patient to a different binder. There's a collaboration there. There's a discussion that they come and feel very comfortable with us having that discussion about what's best for the patient. So even when it comes to changing the binders, if they see that there's a binder not working or something like that, they'll come to me or text me or call me and say, hey, can you give me a call about this certain particular patient? I'm noticing that, this is what's happening with this medication. Do you want to keep them on it? Do you want to change it? And I also have times where the dietitians will actually come and sit with me in my office that's in that area. If I'm in a certain unit, they'll say, hey, do you have time to sit with me and go over the patients? And we'll just sit there and go over all the labs or abnormal labs that's going on with the patient or anything that's that they need addressed. And we just go down the line with the patients. It's like our own little patient review. So there's different ways to, work with your team depending on who you're working with. I'll have a charge nurse that around with me during the treatment times, and we'll, make order changes that way. I may I'll have, the PCTs come to me and say, hey, I noticed, when I try to take this much fluid off the patient, he's feeling this way. Do you want to change the dry way? Do you want us to keep it this way? So there's a collaboration there. There's a discussion there. And I think that's important because sometimes the patient won't tell the doctors, what's going on with them. And a perfect example, I had a patient, I saw her this morning. Everything was great. I said, how are you feeling? She said, good. Any problems with your treatment? No, everything's fine. I walk away. I go to see another patient, and the patient care technician comes to me and say, hey, did she tell you that she's been complaining that her hand is numb and that she's having pain at night and she's not sleeping well? So I went back to her and I said, what happened? You didn't tell me. She goes, oh, I forgot. I don't know where my mind was. I didn't think about it. And I went from not doing anything, not feeling that, writing a note saying, oh, everything's fine, she's stable, to now I have to send her to the vascular surgeon for her to get checked. I end up assessing her hand, which happened to be cool. So she was having some still syndrome. So, it's important that you have that rapport with the staff around you so you deliver the best care. And my staff is very good about letting me know about the patients. They're very good about talking to me about what they feel is going on with the patient or something they think I need to address. And that's important. I think that's what makes nephrology so special, that you have that comfort between the team, that we can just sit down and say, hey, did you know that this is happening? Do you want to do anything about it? Do you think we need to do anything about it? Because when it really comes down to nephrology, it's a team effort. There's no one person that's taking care of everything. You have to have a good team in order to deliver the proper care.
There's no way to do it one
You
person.
can't do it by yourself.
No
No,
way.
there's no way to do it by yourself.
When you mentioned the PCTs, can you elaborate a little bit? Because in Puerto Rico, we don't have PCTs, and I would like the
Oh,
people to understand the term of that role.
okay. So in Florida, in the United States, we have what we call patient care technicians, and they are specifically trained to monitor. Put the patients on dialysis. They take them off their dialysis treatment. They monitor the patients during that time. They monitor any alarms on the dialysis machine. They are the core here in the United States of the unit. Without the PCTs, you're not going to be able to run your patients, because they're the ones who are putting the patients on, that are taking the patients off, that are monitoring the patients. And they usually have about 4 patients on each shift that they monitor. So, and they have 3 shifts. So they see about 12 patients a day that they are physically responsible for. And they're the heart and the butter. I tell people, the PCTs, the patients tell the PCTs things that they don't tell us, because they see them all the time. This is the person that they get to talk to for 4 hours all day during their treatment. So, the PCTs know what's going on at home. They know what they're eating. They know if they look different, or they're saying they don't sound right. They can tell you, she has been coming in. She looks a little tired. She doesn't look herself. She's usually perky. They can pick up on things that we don't see because we're not there with them all the time. We're not there with them for 4 hours. So the patient care technicians here in the States is very important. They're the ones who are putting our patients on, and they're the ones that are monitoring those patients during treatment. And they're the ones that can tell you if the patient is cramping, or the patient is not tolerating that fluid removal, or what's happening during the treatment, or how the access is working. So I really key into my patient care technicians when I round. I make sure I talk to them and ask them questions about what's going on with the patients, because they know the patients. They know what's happening. So they're important. So here in the States, patient care technicians, those are the individuals that are putting on and taking off the patients.
Yeah, that's good to know. In Puerto Rico, the RNs do everything.
Okay.
They do the nursing care. They are everything.
You know, back in the day when I first started, you know, in dialysis, that's where we were. All nurses, you know, were in the hospital. We had an incident unit. And then, you know, I ended up going outpatient, and all of a sudden I was introduced to, you know, dialysis units that have patient care technicians. And it was interesting for me because I wasn't used to it. But, you know, they are great. They are great at what they do. They really take really good care of the patients. And you get some patients that those, if their patient care technician is not there that day, some of them don't even want to run. They're like, she's not here, who's going to stick me? You know, or who's going to put me on? Or, you know, you don't know how to do that. That's not what she does, you know. So they're, you know, it's a family, you know, they get very comfortable with that patient care technician. So, and when with that comfort, they tell them things, they talk to them about what's happening, you know? So, yeah.
In terms of the advanced nephrology nurse, what advanced clinical skills are the most essential for a nurse practitioner in nephrology?
Troubleshooting, being able to troubleshoot, being able to go to your patient and say, this is what's happening. Being able to look at those labs and find that proper diagnosis of what you're seeing, knowing what is not right about that patient, being able to look at that patient's labs or the pattern of what's happening and making a diagnosis. In nephrology, everything is about observing, reviewing labs, seeing the changes in your patients, noticing those changes, and making the right implementations on what to do about those patients. So it's very, very important in nephrology is being able to troubleshoot, being able to recognize what's going on with your patients, being able to diagnose and understanding when there's something occurring. Because it's very easy if you don't pay attention to miss those things. Okay, miss certain things about a patient or a certain lab that maybe, you know, you didn't notice before. So, you know, those are just vital things that just looking at the labs, you may notice things and say, that doesn't seem right. Let me investigate a little bit further. And then you find things that you really didn't even think that could have occurred. You know, we find cancer that way. We find bleeds that way. You know, we find, you know, all kinds of abnormalities just by paying attention to the lab. So it's very important to be able to really assess your patients and look at the patient even as a whole, because sometimes it's not all about what's going on with them in their kidneys. It might be something that's happened with them GI. It might be, you know, they might be bleeding. They might have something going on with their heart, but you have to be able to sit there and see your patients, do your assessment, and come to, you know, the proper diagnosis so you're catching those things.
Yes.
Yeah.
Absolutely.
Yeah.
And specific procedures MPs can do in terms of the collaborative agreement you have in your state. The MPs are able to remove central lines, maybe? Or
So if you're working with a surgeon, yes, that, you know, those are all different capacities. There's a different type of nurse practitioner because we do have vascular surgeons that have vascular MPs, you know, so depending on what you're working in, depending on what your capacity is. As a nephrology nurse practitioner, we don't do vascular. So we're not taking catheters out here. But if our nurse practitioners that work with the vascular centers, they do that. They are, you know, they are the ones that are doing more of the vascular aspect, but that's a different capacity. That's not nephrology, that's vascular.
yeah, they have their
Yeah.
training on those fields.
Right. So they're trained on those fields where, with nephrology, we were mainly working on, you know, assessing the patients, rounding on the patients, I mean, I know how to put a patient on. I know how to take the patient off. I was trained. My background is a nephrology nurse. But if you have you have a nurse practitioner that came into nephrology and she's never worked nephrology, she might not know those things.
Yes, in terms of the preparation for you to become a specialized nephrology nurse, the CNNP. Tell us something about it. How do you prepare? What were the requirements?
For which one? For nephrology NP?
Yes.
So the requirements for nephrology NP is that you had to have at least 2 years as a nephrology nurse practitioner. And in that progress, you also had to have a certain amount of CUs, whether it be like 75 or 100. You had to have those CUs in order to even sit for the boards. I do believe it's now 100 CEUs, and I think it's 25 of them must be pharmaceutical in order for you just to even to sit for the boards. And then once you sit for the boards, then you get the certification.
How, I believe it was very open eye for you, but after you took that certification, how your points of view change in terms of the care you give to the nephrology patients?
I think getting my certification really helped me key into using the best practices, because I still think that I was doing really well as a nurse practitioner in nephrology, but once you have to actually sit for the exam and you have to get certified, I think the beauty of getting certified is that you actually have to key in to what are the best practices for your nephrology specialty. So you really learn more about what the best practices are, what you're supposed to do versus what you see and what you do or what other people have taught you in the past. You really learn the right way to do things or how to approach that problem. So I think.
What are the main challenges that you face in caring for your patients? To give you an example, here in Puerto Rico, we have a huge problem in terms of transitioning patients from CVCs to a permanent vascular access.
Okay.
That's a huge problem here.
Okay.
In your practice more often?
So that's a good question. I think my biggest challenge here is getting the patients on the medications that I think that they really need to be on and not getting the pre-authorizations that I need. Even when putting the pre-authorizations in, you still can't get the patients on, even if you have a justification for putting them on or getting them on the medications. I feel that here we have a big issue with insurances. Even though the patient has insurance, are they, we've shown the justification of why the patient needs those things, and we still have problems getting the pre-authorizations approved. And as you know, if you can't get the patient approved or they say, yes, you can put that patient on, they might want to start the patient on a medication that we don't want to put them on necessarily, because we know that medication is not as good as the medication that we want to put them on. Yes. And it's hard. What makes it really hard is some insurances require you to use a certain medication first and then go to that medication. It's almost like you have to prove that that medication is not going to do it and then put them. So it delays, I find that it delays the patient's progress of them doing really well from the very beginning. And binders are one of them. We have a binder out there that is way better, where they don't have to take as many. And the patients have been shown plenty of studies that taking the medication leads to them having better compliance, meaning that they have better labs and they don't, they're not taking as many tablets, don't have the much pill burden, because pill burden is a huge issue with our patients, especially in nephrology. They take a lot of pills. I mean, average is like 9 to 12 pills a day, and, excuse me, not even 9 to 12 pills. They have 9 or 12 prescriptions. That's just prescriptions that they have 9 to 12 pills, different pills that they have on their list.
Yeah.
Now put a binder on them where they have this one binder that they have to take 3 or 4 tablets a day or 10 tablets a day. And, it's just, it's too much. And then we want them to be compliant. We want them to take all their medications on time every day. It's almost setting them up for failure. So, it's difficult. It's difficult when it comes to getting the right medications for our patients right from the very beginning. I think we have to jump through a lot of hoops to get them on or get them approved or even get funding for them to be on those medications, even though, it's out there. So I think the medications for me is the hardest, is the hardest to grasp, is not being able to get my patient on a medication that I know is going to work for them, that is going to give them less hassle, not as many tablets that will take care of the problem right then and there from the very beginning. So, yeah.
Yeah, that's here as well. I mean, I don't work with in nephrology units. I
Okay.
based program, but I see that problem when I was an RN in the dialysis unit. Yeah,
Yeah.
frustrating. Okay, and now I'm gonna switch to a more administrative talk because
Okay.
practitioners want to know some the strategies of billing and maybe how is the compensation structure in terms of is this a salary, is by patient, how is structured?
Okay. So I think with most of the practices, the nurse practitioners are based on salary. It's not so much hourly, it's based on a salary. So your salary is driven on what the going salary is in that area. So, that's how the raises are done. That's what the salaries are looked at. And it's also looked at as the capacity of work that you're doing. So, you know, how many years you've been in nephrology. So that's how your salary itself is driven. And my salary is by salary. And I'm not paid per hour. I'm paid by a salary. And that salary is what determines how I get paid, bi-weekly.
Okay, and if the on calls or any add to your hours is included in that salary?
So in in contracts, depends on your contract. Your contract might include that you do set, you have a certain amount of on-call that you're responsible for, you know, or not be on call at all, or maybe you're responsible for the hospital rounds and you're responsible. So my contract or my um I guess you could say, yeah, you could say my agreement with my group may be a little different than the agreement that our nurse practitioners that work in the hospital, because they work in a different capacity.
Mhm.
I'm outpatient where they work in hospital. So mainly theirs would include a little different. Maybe they, instead of, their requirement is that they go into the hospital once, on the weekends, where I don't have to do that because I'm outpatient. You understand? So it depends on what your capacity is, depends on what your agreement would be. So it's important to understand, what your role is, what your role in, you know, what is involved in that. What is it your agreement say? What is your responsibilities as either the chronic nurse practitioner, or are the in-hospital nurse practitioner, are you the acute nurse practitioner, what exactly and what capacity are you working in? Because we even have nurse practitioner in nephrology and they work for the transplant center. So their roles are going to be different than even mine or the hospital nurse practitioners that work in my group. Their agreement is going to be different. Their pay is going to be different because they work in a different capacity. So it just depends on what your role is as a nurse practitioner, depends on what that agreement will say.
That's important because it could be like in Puerto Rico is underdeveloped and maybe there's confusion on how are those agreements and how the salary will be arranged.
Hmm.
The NPI number to do the billing, or it do it under the doctor's NPI through the corporation. Do you think that for a starting practice, it will be more feasible to do it the second way, like on the NPI, doctor NPI or corporation?
So so I I'm not sure how it's done in Puerto Rico, but with us, when we see our patients, whatever we order, whatever we do is under our NPI number.
Okay.
So, but depending on the circumstances of what's, with certain billing, or maybe when it comes to if the doctor sees the patient with us, then, it goes under the doctor's NPI, their number instead of ours. So I think the billing just depends on what the circumstances is. But if I see the patient or I order labs or anything like that, that's all under my NPI number. If
Okay.
I order a medication, the patient's medication is under my NPI number. So, and we're separate entities in that aspect, but depending on what the circumstances are with the billing, yeah, they might use the physicians, go with the physician more than, in that different capacity. It just depends on what the circumstances is. But like
Okay.
if I see a patient in the office, I'm seeing a patient by myself, the patient's being seen under my
Yeah.
NPI number. Yeah.
Thank you. Eye-opening, lots of information. Yes, and for some final thought, I would like to see your vision of the nephrology MP role. What do you see in the future, in the next maybe 5, 10 years for MPs in this field?
I think I'm excited for the nephrology NPs because I'm seeing a lot more nurse practitioners coming into the role, interested in nephrology, wanting to know about nephrology. I think, for so long and still to this day, so many people do not know anything about chronic kidney disease. And it's still crazy to believe that people have never heard of it or didn't know it existed, and that there's a problem out there. I mean, it's a silent killer. And that's why I went on and I created my page for that reason, my nephrology page, because I wanted to get that word out there. I wanted other nurses to know that this is a specialty that exists, and this is what our patients are going through, and what, have someone that our patients can look and say, hey, I want to hear more information about my disease and what to do, or maybe which route to go. So I think the main thing with nephrology is that it's becoming a very exciting specialty. A lot of nurse practitioners are now interested in showing that they really want to do nephrology, and I'm excited for it. I've been having a lot of nurse practitioners interested in, rounding with me, shadowing me to find out, how to get into nephrology. So it's exciting. I really believe that, especially with a lot of physicians, because right now nephrology is struggling in the States. It's not many, we're having a very hard time finding nephrologists. And I don't know if that is just because of the capacity of work that we do, but it's a lot of work. Nephrology is not easy. It's not a walk in the park. It requires a lot of hours. Sometimes you're working late, sometimes you're getting up very early. Our patients are very complex. So, I don't know if that is maybe one of the issues as well. But I'm excited to see that there's more nurse practitioners out there that's interested. I think this is going to be great for nephrology. I think we need more nurse practitioners, just like primary care. We need them to step in that role and help take care of our patients, because kidney disease is not getting any better. It's getting worse and it's continuing to grow. We see it. We see the amount of patients growing every day. So you need the nurse practitioners out there rounding on those patients, seeing those patients, providing that care that they need.
Sure, and the spectrum is huge. You can work transplant, vascular access,
Home
home.
administrator, you can work even for an insurance company. I mean, you have nurse practitioners that all day they're calling the patients, checking on them, reviewing their labs on the phone with them. So there's all kinds of different capacities that you can work with, with as a nurse practitioner in nephrology. You can do transplant, you can do, all kinds of different things. So I'm excited. I think nephrology provides, anything with chronic kidney disease provides a unique opening,
Mhm.
for nurse practitioners to step into a different role and really get a lot of knowledge, obtain a lot of knowledge, and become very strong, because nurse practitioners in nephrology are really, really strong nurse practitioners. They're very knowledgeable, they're very versatile, they know how to look at the patient as a whole. And that's important. I think that's what makes us so valuable out there.
Thank you. Some final words for those starting nurses. Maybe we could have nurses here that are just enrolled in a RN program, or a nurse that has been working in dialysis and are looking forward for an MP role. What will you be your final word for them for motivation and any insights?
Don't don't stop. I know it's going to be hard. I know it's long hours. I know it's going to be some days that you go, what have I stepped into? Because nephrology is not, it's intense.
Mhm.
But the reward of seeing how well your patients do, that reward of your patients' family members saying, thank you for taking so much good care of my mom. Are your patients seeing you after you, go on vacation, or you miss a day and I go, where were you? I didn't see you. I was just off one day. Well, I miss you. You can't do that to me anymore. It's a family. Nephrology is so different than any specialty out there. Nephrology is the only specialty that you actually see the patient all the time. You just don't see them when they come for an office visit. You are seeing these patients on a weekly basis. So you get to know them on a personal level. They become your family. So you have a special rapport with them that no other specialty provides. So I tell anyone, any new nurse practitioners that's going into nephrology, hang in there. I know it's tough. I know it can be long hours. I know it can be difficult, but the reward is so much better than you could even imagine. Just having that family, people around you that have the same mindset, that they're there to make sure your patients are okay, is rare. Is something special, and that's what makes nephrology what it is.
Thank you. Amazing interview. I'm proud of what you're doing out there. I hope one day I can see the practice growing like that in Puerto Rico. And the input you gave us today, I know that will be very appreciated for RNs in Puerto Rico and those interested in nephrology. So I really, really appreciate your time and
You're welcome.
your wise advices, and I wish you all the best in your
Oh.
projects, that I know that you are doing something else.
Thank you so much. I appreciate it. Thank you so much for inviting me. This was great.
Thank you.